Welcome to the Consult Before the Cut, your go-to podcast for all things aesthetic, anti-aging, and plastic surgery. I'm your host, Dr. Jonathan Weiler. Been a board-certified plastic surgeon for over 15 years. Been in surgery for over 25 years. I'm owner, founder of Weiler Plastic Surgery Group. Also, Rejuvime Medical, your anti-aging expert clinic. To my right, Taylor Bash, right?
Physician's assistant with Weiler Plastic Surgery. Have worked alongside this guy for a long time.
It's going on 15 years, Taylor.
Talking about all the goodness we have.
Yes, she is an expert injector, been around, been through it all, been really with the, Taylor's been with us for a long time and been in the business for a long time and really from the birth of aesthetics and injectables almost, right?
Yep.
Good. And Taylor, today, what are we going to talk about?
So I'm super excited about today. Today we are talking about liquid facelift, or facial balancing is what you'll hear it called. And what is a liquid facelift? We'll dive into it. We have a guest coming on later.
Yes.
And just to talk about what the process is, what the heck is a liquid facelift, and the differences in facelifts.
Right. So
surgical facelifts.
First, let's talk about the aging process.
Right.
Let's talk about, and so this is your bread and butter, Taylor. You deal with this every day. Taylor is, I want to toot her little horn here for her. She's one of the busiest injectors in the Southeast, probably the busiest injector in the state of Louisiana, is really an expert injector and has people drive from all over the state to see her.
Yeah.
And let's talk about really what the aging process is, right?
So I learned from you a long time ago listening to you consult with your facelift patients because it's obviously, you have to understand the face and the aging process. And it is often talked about and, patients are unaware that, yes, we look old and feel tired, but to understand why is so helpful. So we actually lose bone and fat.
And muscle.
So everything kind of goes to crap. No, really. So losing the bone helps or worsens the support of the face. Right. Losing the fat, I think the fat is the biggest issue, obviously with the collagen and elastin loss. Right. But whenever you lose volume in the face, everything hangs differently. Right. Well, so you can say it in your terms.
So I always let's kind of take a step back, and I always tell patients. So most people come in and they say, "Hey, my skin is aged," or "Hey, my skin's hanging," right? And they're not. And even as practitioners, we used to not think of it as a volume issue, right? In the 70s and even the early 80s up to the early 90s, facelifts were simply just pulling, right? We were just trying to tighten the skin, right?
Right.
But the actual aging process, like you said, is you lose bone, you lose muscle, you lose fat, and your skin starts to loosen, right?
Right.
I tell patients, think of your skull, right, with all that inside of a mylar balloon, right? And everything is shrinking inside of the balloon, right? You're actually losing bone. We know that, right? Well, osteopenia, right? We're losing muscle stock because as we age, our muscles, we can see in our arms aren't as big, right? Same thing happens for the face. And then we also lose volume and fat, which is very important, we've realized. And then, unfortunately, we don't have a rubber balloon. We have a mylar, that shiny balloon that deflates and gets all saggy.
It's not contracting with everything else.
I always tell patients, fat is good. It just needs to be in the right place, right? Look at a young woman and even a young man, that young girl, even if she's as skinny as a pencil, right? She's still going to have fat, but the fat's going to be in her cheeks, lips, breast, and butt. As a man and a woman ages, it goes from the face to the neck, chest to the belly, butt to the thighs, right? And so really,
I tell that literally every day to consults, and he said that for about 15 years.
Yes, I do. That is my. If you do see me, I will say that exact same thing. So we have learned over the years that yes, your skin does loosen, it does age, but simply tightening skin doesn't work, right? We have learned that you need volume, right? You need to replace the volume. And whether it's a liquid facelift, which we're going to discuss today, or a surgical facelift, we still...
Either way, you need the volume.
You need the volume, right? And you can't have it without the volume. And let's sort of talk about the differences between a surgical facelift. I'm not going to go too deep into it, and a liquid facelift, right? So as an injector, Taylor, you specialize in replacing volume, right?
Correct. So a liquid facelift is somebody who is not in dire need of a surgical facelift.
Correct.
So there is a specific candidate that we will talk about, but
There's a window, right? There's a window of
right.
opportunity there.
There's a perfect time where you can get away with a liquid facelift, and that is replacing volume with dermal filler or biostimulatory filler in a combination with botulinum toxin to contour the face, lift the skin, replace the volume that you need.
Right.
Now, if you're in an advanced case, then we're going to talk more of a surgical
procedure. If you come in and let's say, and I'm not being facetious because my parents are, you're 80 years old and you've never had anything done in terms of you've never really taken care of your skin. You've never had filler. You've never had any sort of procedure done on the face to revitalize and rejuvenate. You are not going to be a candidate for a liquid facelift. Right.
A lot of patients say, am I too far gone? Most of the time you aren't.
Right. Most of the time you're not. And there's not a whole lot of, I think as we age as a population, and I notice it mostly in our 70 to 75-year-olds and older, those are still a generation of, I only want surgery and that's all I'm going to do, right? And I'm going to wait till I'm 75, which is not a good idea. The majority of the rest of our population has gotten on board because this stuff, like you said, we've been in this aesthetic practice for over 15 years, and we were coming on at the cusp of it. Now, it was a few years earlier, about 20 years it's been around. This stuff all kind of started in the early 2000s, late 90s, right?
Right.
And so most of the people that are aging into their 50s and 60s have been aware of fillers. And so they're not too far gone. They have had some
It's
stuff.
a beautiful transition, thinking back a long time ago where filler was.
Oh, yeah.
Majority of the times, and I know every injector has the same experience who's been in the industry for a long time, we focused on this little line right here. And that's all we looked at was the little nasolabial fold, maybe a lip. But now being able to look at the full face and pan-facially treat a patient to have a youthful appearance rather than a softened nasolabial fold is pretty amazing.
And it's funny because I'll still have patients come in and I'm in my early 50s and they may be in their early 60s, and they still only want to focus. We don't have anybody rolling in their 30s and 40s and ask about that, right? Or even 50s. It's those 60s.
That was the trend.
That was the trend. That was the thing. I had this filled before. I'll be all right. So it's so different now. So
tell me a little bit about a traditional facelift.
So a traditional facelift. So I like to do my facelifts under local anesthesia, which is a little bit of a difference than most. And so I believe it's a procedure that can easily be done because you're usually an older individual under oral sedation, which is like a Valium. So that does separate me from a lot of guys, although most still do it under traditional anesthesia. But really you're addressing the deeper structures of the face and neck. As we age, we are, I tell people three main things happen. One, the deeper structures of the face and neck, they separate and they start to fall, your actual structures. Two, your skin loses its tone and elasticity. And three, you lose a tremendous amount of facial volume. So when I say the word face, to me, Taylor, the word face is cheekbones down into the neck, right? For me, this is lower eyes. I'm touching my lower eyes. For those of you that are listening, upper eyes is your upper lids, and then your eyebrows up is considered your brow, right? And when Taylor uses the word face, you're kind of talking more of an entire
absolutely.
hairline to the neck, right? And so my definition of face as a surgeon is a little bit more concentrated because we're focusing there. So a traditional facelift is what it's going to do. It's going to go in. You have a muscle in the lower part of your face called the platysma. Everybody, that muscle separates it. Think of it like a hammock. It's going from ear to ear all the way across. When you're in your 20s, it's super tight, right? As you age, and we all are on this bus, this train together, we're all aging. That muscle will separate. It will get loose, and it will then start to hang. And that's going to cause the jowling, around the mouth. It's going to cause the hang from the neck.
Right.
And so the surgical component,
the banding.
The banding. We go in and we actually sew that muscle back together and then pull it really hard around the ears and tighten all that up. So that's what we're doing anatomically. The second thing I like to tell patients is I like to treat your skin. We can pull on that skin as hard as we want, but it's still older skin. So I love an aggressive CO2 laser when
At
you
the
do
same time.
at the same time. I'm sure, and we'll talk about this, you always recommend good skincare,
Right.
get with estheticians. So that's a component of a liquid facelift we'll talk about. So that can be replaced, either I can do it, someone else can do it. And then volume. I do, since we're doing surgery, I like to use what I consider the world's best filler, which is fat, your own body's natural fat. Typically, I take it from the belly button area, around the belly, and I put it back into the face. It goes into the cheek area. It goes into our nasolabial folds, our marionette lines. I'll run it along with jawline. I will put it anywhere I feel like the patient needs it. I do think it has limitations, natural fat. There are surgeons that would argue with me because we do debate about larger fat molecules versus micro versus nano fat.
That's the thing.
Still not 100% on board.
Yeah.
It's just in my hands, it's not as effective, the nano fat. But the larger fat, the deeper fat, I think work extremely well. So
addressing the structure,
yep,
the volume, and the skin.
and
Is a
it's three
facelift.
components, right?
What's your recovery?
Recovery on a facelift to me is typically, off pain medicine a day, really back to normal in 2 or 3 days, looking a little beaten up for 5 to 7 days.
Especially with the CO2.
To the CO2. But I tell patients with makeup, party presentable. And when I say party presentable, be able to go to a function and interact and feel comfortable somewhere between 2 and 3 weeks. Everybody has a little bit of a different healing time, but it's pretty quick.
Yeah.
Pretty impressive.
So that is the gold standard.
It is. It is still the gold standard.
If it fits into,
if it fits into your life. And there is a point where you have to do, if you want that result, you will have to have that muscle, that deeper structure is repaired, right?
Yeah.
It's debatable at what time in your life. I'm actually pushing younger and younger. I know I used to be hold off, but I think in mid to late 50s is actually a good time, especially under local and with the minimal techniques that we use. But
I do want to discuss on another episode local. You keep saying local, and that sets us apart. So we need to dive into that.
We will. We'll talk about that at a different episode.
Time.
But I do think that now there are people out there with good care by you that can push this into their mid to late 60s. I do feel that way.
That's what we say. We're buying time.
We're buying time.
The inevitable is a traditional facelift,
right?
But it doesn't fit into your life.
Right.
You have a wedding in 2 months, which is the notorious thing. Yeah. Your daughter's getting married in 2 months. You don't
can't
have
take
the
3
downtime.
weeks. You can't take 2 or 3 weeks out of your life right now.
That is where we fit in.
Well, and even and I think you fit in. And anybody, let's say, so I grew up in New Orleans and I still go home a lot. And there are, as you start to age in your 50s, you see that people in your life that are very non-believers in maintaining your appearance. And it's amazing. And some of these ladies are in really good shape. It's amazing how they age so much quicker. Does that sort of make sense? People that are very thin. So I say, that aging process can start aggressively in some people in their late 30s and early 40s. Yeah. Especially as you age and you maintain a very thin body habitus. And that's really, to me, where you have to get more aggressive, whether it's, I think the liquid facelift can come in at late 30s to early 40s, really.
Absolutely.
And I think it can be very effective and avoid surgery into your mid 60s, early 60s. So I'd say the window, right, to me is like 35 to 60.
Okay. I would agree, but then I disagree because the younger generation, TikTok, Instagram, they hear facial balancing. That kind of appeases more to them rather than a liquid facelift. But in reality, it can be very, very similar.
Very similar.
And
but I think they're
aware.
I think they're two different
things. Absolutely.
Right?
Yes.
I think facial balancing, like you said, is huge because everybody has facial asymmetry. Yeah. And it is well documented. The more balanced, or if you take one side of your face and you computer image it to the other side of your face, you become a more beautiful person, right?
Yeah, symmetry is beauty. Yeah,
symmetry is beauty, and it's amazing. And they have these programs and these apps that do that. And our movie stars are people that we consider extremely beautiful. It's amazing how balanced they are. And then if you look and when I got into this business, I really learned that. And when you look about unattractiveness, and you really stop and take a look back and say, why is that person maybe not attractive? It's because their face is so unbalanced.
Yeah.
So asymmetric. And so I do think they are, in my mind, similar. You're doing similar things, right? You're injecting pan-facial, large amounts of fillers. But I believe, like you said, facial balancing can occur at 18.
Yeah,
Right?
absolutely.
And it can dramatically improve your appearance.
Yeah.
Or
so
how
I'm
you're
curious,
perceived.
how is that going to affect our demographic now? They're starting younger. So how is it going to affect, fast forward 20 years, are we going to be in a different liquid facelift stage?
I think so. I think
Yeah.
I think we do things now that we never thought we were doing.
Yeah.
I think we've realized the power of these injectables. I think we started with, liquid facelifts. That was a big term.
Right.
Now, like you said, we're going to talk about both. We're going to talk about facial balancing. I think also that I see it all the time. You can modify or change appearances through fillers. And whether it's facial
Sometimes
balance.
negatively.
Oh, sometimes negatively, no doubt. Look, sometimes
That's,
negatively.
sometimes it gets a bad rap.
No,
but
it does.
If done properly.
But if done properly, I think sometimes extremely positively.
Right.
And it just depends on, and we're getting a little off track here, but
I know. Let's dive into.
All right. But let me
What
say
the
something.
heck?
But I always say, look, and I say this to everybody, whether the goal of what we do as providers, as aesthetic providers, we're not necessarily in the business of good work. We do good work. We do good results. We do great results. But we're really in the business of giving patients confidence. Right? We're really we're patient focused. I believe that happy patients means that you're successful. And I always use this reference with breast dogs because everybody knows what a breast dog is, and it's very simple. When you walk in the door, and whether you want the world's smallest implant, which may be 120 cc's, or whether you want the world's largest implant, right, and then get pretty large, I tell patients, if it's safe, you're aware of what the risks are and the surgical, it fits you, if it's going to make you happy and make you confident and make you happy
Bring you
and
joy.
bring you joy, right?
Yeah.
Then I'm all for it.
Yeah. Absolutely.
I'm not the judger of breast size. I have opinions, what I like, right, aesthetically. And breasts is, some people like big droopy breasts. Some like tiny little perky breasts. Some people like big full. Everybody has such a difference with breast, right? And so I always use breasts as an example. So it's the same thing with fillers, right? Whatever makes you confident. What one person likes, another person may say, like some women I know, like my wife likes big noses, like on a man, a big prominent nose on a man. Some people may be horrified by that, right?
Yeah.
It's just everybody has a different personality, or they're drawn to a different thing. And so, like you said, there is bad work out there. But bad work to me is giving somebody what they don't want. That's really
That's
what
a
it
very,
is.
very valid, good point.
All right, let's get back to our topic.
What's a liquid facelift?
So talk to me about, what do you consider a liquid facelift, Taylor?
A liquid facelift is a combination of biostimulatory filler, hyaluronic acid filler,
HA filler, right?
HA filler, and neuromodulators.
Okay.
So that could be brand name Sculptra, Radiesse, Juvederm, Restylane, Botox, Dysport. A combination of those to help replace, lift, contour the face. Replace volume, lift the tissue, contour the face where you are lacking volume. Contour or hide a jowl.
Okay.
Revolumize the lip when they're deflated for over the years. The Botox, the neuromodulators come in to soften muscle activity that is maybe overactive in an area, causing heaviness, causing wrinkles in an area that we want to smooth out. So it's really a combination of everything that we do in the injectable realm.
All of our tools.
Not leaving out the skin.
Right.
I mean, so it's, it's a combination of skincare, lasers,
Right.
chemical peels, microneedling, and then volume replacement.
Let me ask you this.
Which sounds overwhelming, but
When do you walk in and use the term, do you ever walk in and when you meet a patient and say, you need a liquid facelift? Do you actually use that term, or what do you, how do you express to the patient?
Okay, so it is usually a term that a patient brings to
you.
me.
Okay.
And so that it's more of, I never come to a patient and say, oh, you need a liquid facelift, and here's how we get there.
Right.
It is more of just game planning, treatment planning of what we need to do to address the problems that they have. And then I like to say, would you mind me telling you what I see?
Right.
And that usually does evolve to numerous syringes or a treatment plan. But as far as deeming it a liquid facelift, I would say I probably don't use it as much as patients come in asking for it.
What about the term facial
balancing? Use it more.
You do use that more. Okay.
Yes. That is, I think, a more accepted term whenever somebody doesn't really expect that they need a facelift or I think it's a better phrase used. I don't know why, but I do use facial balancing more than a liquid facelift.
So when you walk into a room, this is a patient that you've probably never seen before, right? Someone who's probably new to this world, somebody who's in a crisis, somebody who's looked in the mirror and said, oh my goodness, How did
I get here?
This is not who I see myself as, right?
Right.
You walk in the door, your trigger is, hey, I'm going to have to open up all of my toolbox.
Right.
I'm going to have to use neuromodulators. I'm going to have to use biostimulators. I'm going to have to use HA. I'm going to have to almost drag them over to see my esthetician and make sure that they get on a good regimen and they start something a little bit more aggressive, right? Sort of, I call it a little bit more of aggressive energy-based device, right? I call them. And that to you is when you kick in and go, okay, I'm going to use this term. Liquid facelift may not be accepted, but I'm going to talk about facial balancing because this is going to be a project for us, right? We're going to be in this together. And
understanding the patient's concern is number one. I may see something completely different. Like you said, patient focused.
Patient focus is very important.
They may focus on this darn line right here, this lateral smile line.
Yep.
It's not as easy of a fix just to say, okay, I'm going to put a syringe of filler here. You'll be good to go whenever they're 70 years old. Right. So education is number one in a consultation. So especially in liquid facelifts or facial balancing, I love to do a full-blown consultation. Okay. Educate them, explain them what is going on with their face, everything that we just said about the aging process, explain all that to them, and then develop a treatment plan together. If they're informed, if they see pictures, if they understand what exactly is going to happen, the trust starts there. Okay. And so it's a better journey together.
Do you ever walk in and tell a patient you're not a candidate for this facial balancing and you have to go see a surgeon?
Absolutely.
Okay.
All the time. I wouldn't say all the time, but often, yes.
Do you ever say you have options of either seeing a surgeon or working with me? And this is going to be a little bit of a journey. So
I feel that I would be doing the patient an injustice saying that you will probably benefit and be happier with a facelift. Sometimes I have to say, I'm not going to meet your needs. Right. You will not be happy. And at the end of the day, I want my patients happy. Okay. And if I can get there with you, absolutely, I'm on board. But if it is a point where they need a facelift, we're going to have that conversation and we're going to refer them over to you. And
talk to me about that specific patient that comes in, because I'll see him every once in a while, but you see him a lot more than me, that thinks they need a facelift, but they don't.
Okay.
How do you walk them out of that?
Actually,
that they need a liquid facelift.
2 weeks ago, he had a young girl who wanted a facelift, and he's like, oh my gosh, no. So he sent her to my clinic. Yep. And little things that can be adjusted with filler easily, and they're not even there for. So that is more of a tighter, stronger platysma still. Correct. The thickness of their skin, they still have the support there. The elasticity is not completely gone. Yes. So that is somebody that we absolutely can work with. Absolutely,
yeah. When you have that good skin tone, when you have those hormones, when you're still, in that younger years of your life, volume is the key, not surgery. Right? Premenopausal is the key. So we've talked about what's the benefit in your mind of facial balancing and term liquid facelift versus traditional?
It is a non-surgical option to pan facially contour and improve the face, the skin, with 1 day of downtime. Okay. So the process, you come in, we decide, say you want to treat that day. You have your full game plan. Correct. You come in with a clean face. We numb the skin. We inject the areas. and then you leave.
Right.
No makeup the day of. You
Right.
may have a day or two of bruising.
Yeah, may have a bruise or two.
But as far
Swelling.
as a little bit of swelling, but as far as you have zero restrictions
Right.
the next
The
day.
next day, you're back to it.
You're back
You're
at it.
driving the kids. You're back
Back at
to
it,
working
yes.
out. You're back to work. You may have a little swelling. You may have a little redness. You may have
Right.
a little bruise here and there, but it's all going to go away very quickly.
That is the quicker. Yeah.
What is the downfall? What is the negativities to saying avoiding a more invasive procedure? Is there a downfall?
I think the most important thing is understanding their goal. And if I feel that I am not going to meet their goal, that would be the downfall for me.
Okay.
If they have expectations of a very strong facelift, sometimes I cannot give them that with just filler. It really, it's patient specific.
Do you feel like they're limiting their options in the future if they undergo a facial balancing?
Okay, that's a
liquid
good
facelift?
question.
Do you feel like no? I don't believe so
No.
either.
I think it only, not that it improves it, because the filler is a temporary fill if it's HA filler. But I don't think that in any way it hurts a future facelift.
I think there were some rumors out there, and propagated by surgeons who are trying to battle for their surgical specialty, that filler can cause some scarring long term.
That was more of PLLA, and that correct?
Yes. I still think it oozes into the, some people try to claim it makes surgery more difficult.
Yeah.
And which I don't find that to be true.
I have seen it, or you have seen it and told me, with deoxycholic acid.
That's
That
the
is
only
more of the
exception.
matting
Yes, that's more of the
underneath
scarring,
here.
the matting,
Yeah.
because that is more of an acid type reaction,
Right.
dissolving. So you will see, but it's nothing we can't deal with.
Right.
But she's talking about when we melt the submental fat below, those fat below your chin, in a minimally invasive type where we just inject it.
I want to talk about where we place the filler
Sure.
whenever we're injecting. So he was spot on. I see a face as hairline to your clavicle. So
Right.
this area is what we focus on for a liquid facelift.
And as a surgeon, you typically see a face, when you say the word face, from the cheekbones into the neck.
Right.
Now,
This
eyes
is
and
more-
brow is part of the face, but we separate that out.
Right. So focusing with neuromodulators, Botox, Dysport, glabella, forehead, crow's, platysmal bands, dimpling in the chin, the corners of the mouth, the upper lip, the bunny lines, these little lines here. Filler or biosimilar, stimulatory filler or HA filler can be placed in the temples. I always say this is the hanger of the face. So if we have, it's called temporal hollowing, you start to look like that peanut head.
Get very thin
You
up there.
can start here with filler, and that is going to indirectly help the entire face. So if you start with fullness here, and then not giving you big, unnatural cheeks, but to replace the volume here, once again, is going to help lift and contour. And then the chin and lateral jaw, all of it, it just helps tighten and pull naturally.
Right.
The biostimulatory fillers, which is CAHA, Radius, or PLLA, Sculptra, that is great for here in the submalar area, this
So that's
area,
below the cheeks,
to
right.
help thicken the skin, stimulate that collagen, stimulate the elastin to help lift and contour.
Right.
In addition to the HA filler.
Well, I think one of the things, and we'll take a break here in just a second because we're bringing a patient on. I think one of the things we've realized is that we used to fill, like you said, 15, 20 years ago, just the nasolabial folds, right? And then we moved from the nasolabial folds into, let's call it the cheek, for the cheek area, the malar area, right? Which is a good step up, right? And then now we've learned that we've got to get into the whole face, right? That you look funny if you just focus on one area, right? And so
That's what I would say. I feel like you can tell people had filler
yes,
if you do that.
Yes.
If you pan facially treat your face, it is very natural and does not look like
looks
you have
amazing.
filler.
I think I'm not bashing on people here, but I think what happens is filler, whether it be biostimulatory stuff or HAs, which are, we can use the brand names Juvederm, Juvederm Ultra Plus, Sculpture, or whether you're using Botox, the good thing is that these things are so widely available. The bad thing is that they're so widely available,
Yeah.
right?
Yeah.
That any Tom, Dick, and Harry with a medical license, whether it be in some states, estheticians,
Right.
can do an injector,
Right.
be an injector. And the problem is that there's not a whole lot of really good training out there.
Yeah.
It's very, very difficult. The bar to entry is extremely low. Anybody can get in. It's sort of like, I'm not, hopefully not offending real estate agents, but anybody can be a real estate agent. But there's very few good real estate agents, right? I have a fabulous guy that I've used for years that does all of my real estate. And then I have friends that are great friends, but I would never use them because they sell one house a year or two.
Yeah.
They're part-time, right? And so that's, to me, is that, the separation,
a good analogy.
right? The separation is so vast. So when people say, oh, I don't want to do filler because you look funny, well, that's because they went to a bad injector, typically, not a bad product. It's
or their
wasn't
comfort
used.
or their product arbitorium is limited. So
Yeah,
they're
well,
only going to use.
they're not using the full toolbox.
That's right.
They're building a house out of just nails and plywood.
Right.
They're not using siding. They're not using carpet.
Yeah.
Yeah, it looks bad.
Yeah.
So I think that's the real problem with it. But we have learned, like you said, to start, and that's a wonderful. You see the face from the hairline down into the neck, and there's so many tools. And like you said, you have to touch each one, right? And I always tell people, like, just because chocolate cake is good doesn't mean you eat the whole chocolate cake. Thanksgiving meal is not just turkey; it's all the little ingredients, and so you have to use all those little things to get those incredible results. And that's why the terms facial balancing, liquid facelift are really effective. And I think in your long-term patients, you do all these things, but over a longer period of time, right? Over a year or two, because they have time because they've started young. But when you have come in and let's say you're 55 years old and you've never done anything and your daughter's getting married and you don't want to look like an old hag compared to these young girls. I'm not trying to be mean, but you come in and you're in a panic because in 3 months you're the center of attention. That's when you need the liquid facelift. That's when you need the facial balancing. That's when you may have to throw down a couple of $1,000.
So that is a good point. We didn't talk about budget. So budget, that plays into this.
Oh, yeah.
I always say it's a marathon. This is a marathon. We can do a sprint and get it done, or we can work together over months to years
to get it done.
And get it done.
Right.
So it can be all at once, or it can be, slowly. So that could be $2,000, $1,800, all the way to $10,000. It really depends on what we're doing.
It depends on your time frame, what you want, results. Good work ain't cheap, right? And cheap work ain't good.
Yeah.
So you got to be careful. You want to go to reputable people, and I always tell people you want to go to somebody that has all the tools, right? Whether it's surgery, me, whether it's you. I don't do injectables anymore because I'm too busy doing facelifts.
Right.
You don't do surgery because you're too busy doing injectables.
Yeah.
You don't see, what I'm saying? Like, and there's something to that. We have estheticians. We have something to fill every single
place.
So we're going to take a break.
Bring on,
Yep. We're going to bring back a patient, right? And we're going to talk a little bit about liquid facelifts and
thank you for
I lost my memory there. No, we're going to talk a little bit more about facial balancing and liquid facelifts when we come back after the break.
From Botox to tummy tucks, we provide patients with real confidence. Weiler Plastic Surgery. Something real.
I wanted to lose weight, and Rejuvime Medical made it easy. I did lab work and then a one-on-one consultation where we talked about goals and a treatment plan, and I started losing weight within a few weeks and was down 30 pounds in 3 months. The nurses and the medical providers made me feel comfortable, and I'm the most comfortable I have ever been in years. My name is Parker Ramirez, and I want to tell everyone I know to change their life and to get started now. Rejuvime Medical is the best option because they'll be at your side the entire way.
All right, guys, welcome back to the Consult Before the Cut. We'd like to thank our sponsors before we get rolling here. We'd like to thank Rejuvime Medical, the age-defying clinic, your hormone and GLP-1 experts in the state of Louisiana and Mississippi. We'd also like to thank Weiler Plastic Surgery Group, the largest plastic surgery-driven aesthetic group in the state of Louisiana. Yep. Me and Taylor have grown this sucker. We are growing. We are growing.
Not stopping now.
So we are back, and our topic once again today is facial balancing and / liquid facelift, right?
That's right.
Taylor's our expert injector. Taylor's been doing this for over 15 years, right? Board certified plastic surgeon for those of us that are just joining. Our other member, Brittany, is out today. She'll be back joining us. We've got a 3-man group to rotate, and we'd like to welcome Mary, our patient for today. Mary Latner, right? Am I saying that right? Last name?
You are. Very good.
Now, Mary is, we're in Louisiana, right? A little bit. You've moved to Louisiana recently.
Yes.
Where are you from originally?
Originally from Iowa.
Iowa. Oh, that's a good college team right now.
Yes. Yeah, they're doing fantastic.
So, Mary, I want to start with you just giving us a little insight on your journey. Not so much, don't dive so much into the actual process, but how did you get here? Tell us a little bit about you, about your face, what you...
aesthetic journey.
Yeah,
Yeah,
aesthetic journey.
absolutely. So I am 53 years old, and a couple years ago, I started noticing some signs of aging, really significant. And then also I had gained a significant amount of weight. So I started a wellness journey back in April to lose weight, and then also
April 2024?
April of 2024.
Can I ask you a question? So there's been a large study that came out about the aging process. When do you feel like age-wise?
You started, yeah.
You
that's
really
good.
felt like, go back to your life. When did you felt like you really got, my goodness, what happened to me?
I would say probably my mid 40s.
That's all. So the age.
Don't say that. I feel like 40, I'm like
The
plummeting.
age is somewhere, we believe, between 44 and 46.
Yeah.
And then we believe that's the first mega aging. And then the second mega aging is 62 to 64 is the second.
Really?
Yes. They've identified this. Very large study came out that said your cells accelerate aging at those 2 periods in your life, which is crazy. So anyway,
Wow.
we broke
So
off.
she was
but
spot on.
You're spot on.
Oh my gosh.
This is great. That's awesome. Well, good.
And so, mid 40s. And previously, for the past 2 years, I'd been traveling a lot weekly in airports every week.
Which wears on you.
Different environments, different climates. And I just noticed when I stopped doing that, looking at your face, like finally saying, oh my gosh. So that's how I'm like, I have to do something. And not feeling good also. The menopause also was a contributing factor.
I'm about the same age, married to a woman about the same age. It's a rough time to go through.
Yeah.
Absolutely. And it does hurt your skin tone, texture, everything, right?
Yes, everything.
So in that wellness journey, did you have weight loss involved in that process? How much weight did you lose?
So I've lost 50 pounds.
Wow.
It's
Amazing.
Yeah.
It's awesome.
Okay, so we're in December, so that's what, 8 months ago? 8 months.
Yes.
Wow.
amazing.
Okay.
Yeah.
So go ahead. So tell us your first step.
Okay,
What
so
was
my
Let me ask you
first?
this. How do you feel the weight loss? So obviously the aging is going on. Do you feel like the weight loss accelerated your aging a little bit?
I knew
that's good.
when I went on this wellness journey and losing weight that I was going to have more probably hollowing and jowling because my face was pretty round, even though I had a lot of wrinkles creeping up and things like that. So made an appointment with Taylor, and she walked me through we need to start doing something now, because she asked me my goals and where I wanted to be, and said, okay, we have to get you on a journey here with your skin as well, with the weight loss.
So the first thing that you did was Botox.
Yes.
And a little bit of filler.
Yes.
Right?
Yep.
So tell us about that.
So did about units and things.
No, just areas.
Okay.
Yeah,
just
and
areas.
let me
So-
ask you this. Was this your first entry into this type of stuff? Or
Yes,
Yes.
it
Really?
was
Yes.
really the
Really?
first
Okay.
time. Okay,
Wow,
because
I'm
I have to tell you,
Yes.
I was
So you were
very
naive.
naive.
Virgin,
Yes.
Coming in, right?
Yes. So I was
53-year-old virgin.
yeah, if you can believe it. So I was very all natural. I was
Okay.
very, hippie, organic. I'm not putting that into
Yep.
my face. And
Let me ask you this, what caused you to sort of shift that mindset a little bit?
Taylor,
okay.
Taylor did. She
Good.
really did. She educated me a lot on, okay, let's talk through this. And we talked through it. And so I did my forehead, did a brow lift, crow's feet, did a jaw, and
Platysmal bands.
Yep.
Here.
yes.
Then she started slowly with filler.
Yes.
So a little bit of filler in her lip, a little bit in the mid face.
Yes.
Just to restore a little bit of volume. So that was, I would say, undertreated the first time. Would you agree?
Probably, yes. Yes.
Yeah, the first time was undertreated.
When you
Saw
say
improvement.
when you say
just very
undertreated, what do you mean?
conservative.
Okay.
Conservative,
Didn't
yeah.
replace the volume.
So you kind of went a little easy. I mean, is that kind of like you said, let's say if we use syringe amounts, I would maybe use, Taylor, in your mind, you wanted to use 6.
Correct.
And you used 3 or 4.
Two.
Or 2.
Two.
Okay,
Yeah,
good.
2.
Good.
And 53, 2 syringes of filler
Yes.
is a very conservative
Correct.
amount.
Yes.
Correct.
I always use this analogy. 5 syringes of filler is a teaspoon.
Yep.
5 syringes of filler is a teaspoon. And I tell pretty much every patient that to help them
Yes.
understand that 2 syringes is very conservative. But probably 3 months later, we did 6 syringes.
Yes.
5 or 6 syringes, and that brought her closer to correction. And I think that's when you saw the big
change.
improvement.
Oh,
right?
significant.
Yeah.
Yes, significant
So
improvement.
tell us the process when you were in the clinic.
Yep.
You came in, you numbed. How was the pain? How was the recovery? Give a little bit of insight with that.
Yeah. So the pain numbed, didn't feel much, a little bit when they got to the jawline because of all the things that surround that. Minimal bruising. Next day, didn't wear makeup the rest of the day. I think I was nervous, so I didn't wear makeup the next day. A little bit of bruising. Walked me through kind of what to expect the night before, which was really great, and the next day. So then the next day after that, I wore makeup, and I could really see
A difference.
starting to see the difference.
Yeah. I saw you the day after, and she was kind of the exception. She looked better than most. Most people will have a little bit of bruising and swelling, but you looked exceptional 24 hours after.
Yeah, minimal bruising,
Yeah.
not a lot of pain. It was great.
Do you think that you will, so the products that you have will last about 18 months. Do you think that you will maintain this?
Oh, I absolutely will. Because
Yeah.
I think and I think women my age too are always looking in the mirror because we know that we're aging
Yeah.
daily.
That's a good point. So talk to me. Taylor wants to talk specifics about I want to talk about the emotions, right? So talk to me about your thoughts walking in, thinking, all right, I'm about to do 6 syringes filler,
Yeah.
right?
Yeah.
Talk to me. Were you fearful? Were you excited? Were you nervous? Does that make sense? What were you feeling walking in?
I was feeling all the things. I was fearful, excited, nervous, because when you go from someone who really believed in all natural things
Right.
and I was going to age naturally and, just try
Were you
to fight
disappointed
it
in
every
yourself that you've given up? I mean, honestly, like, what or are you like over that? And like, okay, so I'm retraining my brain
Yeah.
and I'm re-educating myself.
I really had to re-educate myself and retrain my brain. And I'll tell you the thing that, to Taylor's credit, and what made me buy in, and I think what would make most women buy in, is the education behind it. She did not try to force me to do more than I was comfortable with.
Right.
But when I saw the little bit of results from the first time, it made me really trust her
Right.
to go all in
Right.
the second time.
And you
Yeah.
gave her that little window, and she's
Yep.
in.
She is in, yes.
She's getting that filler in
Yeah.
there.
So
Results.
education, I think that's it.
I agree.
I mean, absolutely.
Yes.
And it comes to a point where we want to feel better about ourselves. And how do we get
about
there?
confidence.
It's about confidence.
Yes.
Absolutely. How do we get there? If informed education, then they have the transportation to get there.
All right, let me ask this, Mary. Was it more about just in your mindset that you just some people just want to be natural to begin with all the way through, or is it you had negative connotations of filler?
Negative connotations, thanks to reality TV. You didn't want to be overfilled.
They want to be a Real Housewife of
Yeah,
of Dubai.
Yes. And I think that's a
He
real.
used to watch all
I
those
do
Real
love Real
Housewives. So.
Same. And so you think that like, oh, I can't get 6 syringes of
Right.
filler. I'm going to be
You do.
overfilled. I'm going to be looking crazy.
Right.
And now looking at myself today, and even when I went back home, everybody's like, what are you doing?
Oh, really?
Lots of,
Oh,
lots
that's
of
awesome.
compliments.
Okay, good.
Yes.
That's the next question. Emotions afterwards. Married, correct? Or
Yes.
what kind of feedback did you get from your husband? Any at all? Or did he notice? Did he say anything? Or friends and family?
He didn't really notice at first, but after a couple days, he's like, did you get some done? I'm like,
That's so funny. Men are crazy.
All right.
I mean,
Crazy. Men are
but-
sort of oblivious.
Yeah.
Now,
that is the best thing.
Men are
They
oblivious.
don't know exactly what you
they don't
did.
know
That's
what
the
they-
best compliment.
Yes.
Did you do something?
Right.
Did you change your hair
They
color?
know
Your
something's
makeup?
going on,
Something
right.
looks good. I
And
mean,
and then you have daughters, right?
Yes.
So and you don't live very close to the daughters, right? So they saw you. It was sort of like a unveiling, right? A little bit.
Yes.
What was their reaction?
and with 50 pounds weight
Yeah,
change,
yeah.
like, whoa.
Yeah, they were like, so we recently went out as a family, and someone had came up to my daughter actually and said, introduced everybody, except she goes, oh, is this your sister from Iowa that you tell me about?
Oh.
And she was like, it's my mother.
Yeah, but they're like, yeah.
I was like, yep,
Yep.
I'm the sister.
Oh my gosh, that's good. Oh, that's awesome.
That's awesome. That's awesome. So great experience, right?
Yes.
What would you tell a scared 50-year-old female?
I would tell them to go in, get a consultation first, write down questions and bring them with you, because when you're in the consult, there's so much information, education thrown at you.
That's
You're
a
going to
great-
forget.
That's a great point.
You're
Write
going to
things
forget
down.
to ask.
Come in with a list, right?
Come in with a list, ask all of your questions, and tell the injector what you're fearful of, so they can make sure that when they're treating you, that they
Meet
address those
yeah,
things.
Yeah. And your main concern, because your main concern may be different than my main concern.
Correct.
So that is important to understand that both ways.
Yes.
We all see ourselves differently
Yep.
in the mirror, right? We're our own worst critic, number one, right?
Yes.
And I always say this all the time. We typically envision ourselves as that 18-year-old person, whether we're 50 or 80, 22. We see ourselves with the positives and the negatives that we were at
Yes.
18. I see it all the time, especially in the body. And we'll have a conversation about this, and so I think it's important to get feedback from a great
An external source, yeah.
external source
Yeah.
Yes.
to say, I know you're concerned about this, but this is what's really aging you.
Yeah.
Right? I always tell the story. I'm going to tell it real quick and then we're going to cut out of here. But I had this patient. I used to have this consultant. She was a little crazy. She was hilarious. She was really good. And so this patient came in. She was in her
can't wait to hear who he's
mid
talking
to late 50s, right? 60, 61. Came in and we're doing a mommy makeover. Okay? Came in, we went through the breast, went through the tummy, all this stuff, right? So we're in the room, we talk about it, we talk about what we're gonna do. And how the process works is the patient and the consultant then go into the consultant's office and get a quote, all right? And so patient and consultant went into the patient's office, got a quote. 2 hours later, clinic ends, and I'm talking to my consultant. And I'll run through my patients for the day. So, well, how did that patient do? Did she schedule her surgery? She said, yeah, she's scheduled. I'm like, that's great. Tummy tuck and breast hog? Hell no. I'm like, what? Yeah, I got her in that room and said, girl, you gotta start worrying about your body. Your face is what you need to worry about. She's doing a facelift. I CO2 laser and fat. Like, what? Yeah, she's going to re-meet with you next week and you're going to do that on her. I'm like, all right. So it was pretty funny. So,
Oh my gosh.
because that patient saw herself,
Yeah.
her figure, right? But,
That's what she was focusing
That's what
on.
she was focusing
Yeah.
on. But her figure wasn't really that bad. And that's what this girl's point was, is focus on the face. That's what someone sees every day. So
That's good.
it's a funny story. So I always tell, what we see in the mirror is not what others see in the mirror. So good. Anything else to add, Mary? Anything that you think, if someone's watching this and it's two scenarios. Someone's watching this and they've never had a filler or Botox. They're a real organic, like you said, granola type person. What would you say to them, number one? And number two, what would you say to the person that's had a bad experience with it, that has went in and felt betrayed or felt like they got their money taken? Does that make sense?
Wasted their money. Yeah.
Give me those two scenarios,
Yeah.
and what would you say to those in your period of life?
Right.
I would say, to someone who was like me, a little hippie, a little granola, not believing in all these things, set up a consultation, educate yourself, talk and walk through with your provider your fears, why you don't believe in it, and so they can educate you on why it is a good choice for you, and that your body won't have all the fears that you're probably afraid of.
Right.
And someone that's had a bad experience, I would give Weiler Plastic Surgery a chance. Meet with the injectors there are very highly educated. Walk them through your experience, walk them through your fears, and see if there's something that they can do to meet your goals and meet your expectations.
Right. I think it's, we're a little off topic here. I think one of the things is there are bad injectors, there are bad surgeons. So if you did or felt like something or have these concerns, and if you don't jive with your injector, go to another injector. Right?
Yes.
Go, and if you feel unconfident, go to another injector, because these are bigger procedures and these are important.
And the biggest thing for me is the consultation and seeing if we can meet an expectation that the patient has.
Your expectations are so
that is, you have to set the expectation, because that may be why you had a negative
experience.
Yeah.
Exactly right.
And
go ahead. Sorry.
one thing that I would like to add is it's a marathon, not a sprint. Not a sprint. And so give yourself the time for all the things to work, and ask those questions with your injector. Like, what can I expect in the next 6 months? What can I expect in the next year? And what should I do at home to complement and help?
Yeah, absolutely.
All right, guys. I appreciate it. Thank you guys for Mary for coming on set for us, and thank you guys for watching the consult before the cut. Stay tuned for our next episode.